we chakamot ku we chake lor we koi ke beben ku koi ke bedai koi ke beping ni yamante anu biodana ngo juer de yemen chake ting ku chake ping winter ne lobida mana de yen ke buku loy ni yokol non presentation they study yen bi wo ben ku kane yen ka bi wo jamtin koi ke ai koi war bo ba iten ke jel ne ke chu tong ke refugees visit kene yen ka message ku data kene is being collected now abag ping kai karo ke ka bi wo ka jam kene ke ran twing dictor ton kwarang yai randa ta kene wok nana wen randa ro a professor uh, mengi broad job belwel ni yen e pyoj du pyoj fi jama ku ye na tawn west ku ke pyoj indiana ti yen pyoj tin kulande ka ka kadi ab ke job be waw ni yen we ba ke tiej ba ku lo share yen ngadi kan yen show kan ku bi ka yo jamda abe dir ne biag de english ashano kan ke study yen ka loy ku ke data yen ka lui collected akor big explain ku baka ping yung yen kor ken ku piade yung ku tiek de kan ngo so ken yen ka mesen ni yaman tay we ko ke ben we chak lor we chak eng mot ambe dita bata wo ma ku buku nang zaman tin kor ku ka ba ke bay wo chi bagaw chi be ber like I said ngadi yen ka bi wolo tin bas uh, lo ye go explain ni yen ran yen nong nom lo ye kan ton kwarang ko ke lu partner big data big collected so kene yen ka bro lo ko we cha ka lor we cha ke mo welcome. Share it, please, share it. Hey, and we will leave it there. I ask you to share it, guys, and I will bring Dr. Jacob and Dr. Mingsi. Welcome, Jacob. Welcome, Mingsi.
Thank you, Mabir. Thank you so much for the nice introduction.
My pleasure. My pleasure. Welcome all. Our tonight show is based on the study that is being done. It's all about COVID and the people that are left out that need to be added and would be part of this study are refugees who came from uh, South Sudan, Somalia, all the places that refugees left and came to the United States. With that, I will not exhaust the idea, but the population of the refugees being affected by the COVID in the United States is highly needed, and it needs to be part of the study that is being done. For those who don't understand English, I will try to go back and forth to explain what these two will communicate to us. It's very important to see the impact and to see the benefit of this study, what is going to imply with. and what we are going to get out of it. So it's very important, and it's a pleasure to host you as a individual who is on the process of studying this. And it would be good to know the result. Where do we fit in, and what are the impact of this on our communities? Most of us don't speak English. Uh, for those who don't, they will listen and they will learn from you. For those who also who have studied in different fields and do not know very much about what is being done between these studies and CDC, you will educate them tonight. And maybe it will be more easier for Dr. Thon, who is a uh, researcher on this issue with you. He spoke with us, and more detail will come because this might be a second or third phase of this process. Welcome. You can introduce yourself, and Dr. Thon, you will come after. Thank you, and welcome to South Sudan community. I say that because Teach is a part of the larger community. We have different sections within South Sudan. The particular part that you are going to speak with, or the population of this community, is larger, but is very specific. It's Teach community of the United States. Welcome. Thank you.
Well, thank you, Mobir, and thank you to the viewers. Please share the link. I'm seeing about 25 people already. I have put the link there. Mobir, you can pinpoint the link to our survey. Please, as we talk, it takes less than 15 minutes. Please share it. It is my honor to share with you today my colleague Maggie. Welcome to Twitch East Community TV, but the broader is South Sudanese. There's a lot of South Sudanese who may watch us. It's not just a one particular section that we came from. The objective today is for our study, which is the impact of COVID-19 on, in this particular case, on South Sudanese refugee community. And we will talk about the importance of it. And just to let you know, what we had done in our community is when COVID-19 hit, we gathered together with health professionals, from medical doctor to public health to registered nurse to LPN, all of the health professionals, to create awareness. And we did it in our local community called Twitch East. And then not only that, I'm the chairman of that committee. Not only that, we have South Sudanese health professionals that we give advice. There is leaders like Dr. John Quick, who is also, they call it South Sudanese COVID-19 task force. So there's been a really awareness since COVID-19 hit. That's the great news. This is the beauty of this country. Why? Because when I got here, nobody I knew that could speak my language, and nobody I knew that could actually, in a medical professional. It took us, 15 years, and some of us are doctors and PhD are not. So this is such a great opportunity. We appreciate Mabir Dow for hosting us. I'm so excited so you can talk to our viewers what is the benefit. But our goal tonight, I hope we can get 200 participants. So far, last time I checked, we have 4 people. But I believe the people of South Sudanese will be generous enough, because it's not just only us. It is the benefit to the community, which we will talk about, and the importance of data. So I want to welcome you. We have a best moderator, and I want to encourage all of you, my fellow South Sudanese American, please, as we speak for this limited about time, it takes you less than 15 minutes to fill this survey. So Mabir, I just want to welcome my colleague. I really appreciate the time, and I will talk more later to some of our experiences when I talk to the COVID-19 patient in our community. When I hear the story, these stories are not captured in the data. And this is what we're trying to do. And it's not just only going to hopefully help them, is the whole world, the scientific community, which is CDC, the DHS, Department of Health, Human Services. It is time to know what is happening. And here's the good news. There's a vaccine now, which we have some of the questions about that. So welcome to Tree East TV and welcome to South Sudanese community in diaspora.
Welcome.
Thank you, Mobir. Thank you so much, Jacob, for the nice introduction and explanation of the study. So I want to give you a really short explanation about the study, and I want to let you know like how this study could change our community. So back to May, I was working with several scholars from University of Pittsburgh and Johns Hopkins University. So when COVID just hit, and we were thinking about what we can do for the refugee community, and all of us have experience in working with the refugee community. So what we did is we sent a survey asking questions about the refugees' experience with COVID. So what happened was, so we were able to collect data from various refugee communities. So what we find was back to May, so between May 15th to June the 1st, 7% of the refugees were infected with COVID, and at least 1/3 of the participants experienced COVID-related discrimination, and almost half of the refugees experienced COVID-related depression. So some of the findings from this study were published, and also like we were also invited by CDC to present the study. So for the last round, we were only able to like recruit participants from the Burmese and Bhutanese refugee community. So we were encouraged to enlarge the study to like include different kinds of different refugee communities. So this time we were encouraged to talk with the Society of Refugee Health Providers, and that's how I know Jacob. So as a leader of the Sudanese of the South Sudanese community, and Jacob helped us to make the connections with the community, and also to help us to share the information with your community. So what we plan to do this time is we will use the similar questionnaire, but we added the information of the vaccine perspective and also perspective of the current policies. So besides, we will also ask your information about your COVID experience, like whether or not you were infected by COVID and whether or not you were tested with COVID, and have you done like contact tracing. So some of this information, but we do not ask anything about your identification information. So please don't worry about like any of your private information to be released. And the good news is, so our collaborator just heard from CDC today that the CDC is waiting for our data. And why this information is important is because, as you know, the vaccine is available, and the government is trying to see like which community is vulnerable or which communities do have concerns about the vaccine. And I really hope our data could tell them a better story, like what is really needed in the refugee community. If we find there is a really big need in our community regarding like vaccination or like contact tracing, and hopefully government like could help us with like this locating the resources, and it can also help us with recovering from COVID.
Thank you so much for giving us insight about that. So let's go back to the term refugee. Who do you define as a refugee?
Thank you so much for this question. So we define refugee as those who are forced to leave their country because of conflict or war in their own country.
Indeed.
So yes, so I know like, so we were talking about this. So like, I think like, so like some of the like our participants like came to the US as refugees, but later they become like the US citizen. But for our study, and you please join our study because you came to the US as refugees.
Thank you. Was now to know we koi chi tong jing japit of which will explain chana chiran koi chi tong kawai jang japit chilwe la ke koi war bo koi ke chu tong ke na iran bi tong ke yin willing te chu yin biaga kuma koi ben asylum ko ka yes, a part of it. Lekin ke gwik ko koi war ke bot in population ye ne bo ke cho tong ke bi ke na kuma ye ne ngadi ku ka ben ke citizen man koi ke ka gwe ngadi study ke kana ko ko che South Sudanese community only, and this is not specific to Twitch community. A South Sudanese community, whether you are from Baragazal, Half an Isle, whatever community in the United States that is pertain to South Sudan, you know, this study. Kukor a 200 population, a 200, a koi kuchike yo in our community. Ke kan abedu chien ku kabene follow up to now walk buku ke koi buku ke tie kan chilo koi no ku chuku met ne bai wudi ne biag de koloi fa kene gale benang further benefit no we ko ke to be ten kene lu ke explain to non ko chi ngi japet ku we ko ke ngi chen. Let's try 200 is not that big. Our community of Twitch can do this alone without any other community, but we encourage every community in the United States, South Sudanese communities, to go into this and try to fill it out. Your information, personal information, is not needed. A basic information like what you have on Facebook, that's all is needed. It's not going to require social security. It doesn't require your ID and any of the above. Kaga kadia achi ke gwek. Ke gwek bas the population. Kubiting the koike chan wo ka nyai kemana de community da chine twaintin ye nga che chen lo ya chan covid ye nga che chen pir pia ta chan covid ka a che ka tian ke ka kor ka yen ko bi ke ngi. Thank you so much we ko ke jipin ko ke dai and be your do chen. Thank you. What I was explaining there is the population that is needed and what is this is for and how we become part of the bigger picture of this study. The state needs this kind of information, and the Fed need this kind of information. And this information is coming from us, we, the citizen of the United States. I believe this is going across the board. The 200 people that are being asked to do the survey are just for the South Sudan community. What other communities are involved in this study that are refugees communities that came to the United States because they were forced out of their home country?
Thank you so much for asking these questions. So far, we have community leaders from we have Bhutanese refugee, Burmese refugee community. We also have communities like the Afghan community, Somali community, and also our South Sudan community.
Indeed. What pace of study is this? Have you done something like this before, or is this the beginning moving forward?
Yeah, so this is the beginning of our COVID study. So this is the second round of data collection. So for the first round of data collection, we did it in May. So using similar questionnaire. So in the first round of survey, we actually sent the survey to different communities, but we only get response from Burmese and Bhutanese community. So, but we really hope this time, this is the first time we are collecting data from the other refugee communities. So, and well, I did lots of search with a recent publication, and the information of our South Sudanese community, I just couldn't find it. So I really hope our information could raise government's attention about what we are experiencing during COVID. And as you mentioned, I hope this is not the end. Hopefully, we could continue working on this.
Yeah, I want to also add, yes, I'm part of Refugee Society, which is, these are doctors in the United States and in Canada, in North America, who treat mostly refugee patients or immigrant or asylum seekers. And I published another paper to look at the provider's perspective. What is their understanding of the patient when these refugees coming in? So that paper is in the public, but what is interesting now is what Dr. Maggie and our colleagues from these other communities looking at is what is the patient experience?
Right.
So now we'll be able to combine, we understand the provider's physician perspective, we understand the patient perspective, and it become a matter of policy as you guys already heard, the CDC is already interested in our data. And the question you asked, Mabir, about the community is it's like Dr. Migi said, we have Somali, we have Burmese, like, and each community, we would like to have a sample of 200 each to at least have more sample, the better it is. But 200, I agree, it's better. We can do it even before this show is over. So thank you for the question, Mabir. And we have 40 right now. If you people just go in within 10 minutes, it will be done. So, and share it with people, please.
Thank
Yeah.
you.
Thank you
Tell
so much, Jacob.
tell
Mabir.
us about your background on doing this. Is this the first time you're doing this, or have you been doing this?
You mean for the survey study?
Survey study and your work in the data science with data
Yeah.
science.
So I have been doing this for almost 8 years. So I complete my medical training in China. That was years ago. And then I did my master and doctor training in international health and development. So through my training, I have been doing like health science related research. And I started like doing refugee related study. That was back to 2012 when I was a PhD student. So I worked with the refugee community in New Orleans. So we did a longitudinal study to measure the long-term impact of Hurricane Katrina on refugee communities. So since then, I started doing research with refugee communities. And it's a really great experience to know like refugee community leaders, they have been really passionate about changing the health in the community. So I just want to share really good news I just heard from the Burmese community in Indianapolis. So we have been working together. His name is Wunyan. So I have been working with Wunyan on several studies, like to raise, for example, to raise awareness about maternal and child health in the community. So we have been also working with government. So he just told me that the government want to increase the awareness of vaccine in the Burmese community in Indiana. So they have been collaborating with Union to provide funding to do like vaccine campaign. So I really hope like this funding and support from government could happen in all the refugee community. And the way for the government to know this information is through doing a survey. I know like this probably like you will feel like this is really bothering and why am I feeling this information? But data is really powerful and the data is the only way to raise people's awareness. And the 200, the reason is because like we need to make sure the sample size is sufficient to tell us a representative story. So for example, if we only include the information, like for example, if we only have like data from 20 participants from the South Sudanese community, and the 20 may not help, like that's really good information, but the sample size is too small to help us to understand a comprehensive story in the community. That's why we need to make sure like a certain amount of participants could fill the survey with more information, like in our data set, we're able to tell a better story and a more representative story to represent the people in our community.
So, Dr. Miggy, you cannot read the comment, but I could tell you I am so excited. 3 people already said they have completed. Somebody said that it was convinced now that because of this forum. Don't worry. Our South Sudanese community are serious, and now that we know there's a benefit, Maria, what you asked is we are professional in our research. For example, me as a refugee, why I am in several board in with CDC and the rest, it's not just my expertise in public health. Okay, I understand what it means to be a refugee coming to this country and try to fall in the crack. We all knows that, whether you have Medicaid, Medicare, whether you don't have health, these are the real issues that we, as a refugee community in general, we fall in the crack. Just to let you know, personally, not only as a refugee, I was involved with my dissertation. My dissertation was looking at the morbidity and mortality of children among children under the age of 5 in the refugee camp. And you can understand why I say this. So I look at refugee camp in Ethiopia, Kenya, in East Africa. And I did that because of our experience. All of you has experienced the difficulty of accessing healthcare in a refugee camp. And fast forward, we still have difficulty accessing healthcare. And then now we have the pandemic. So we are way, way more vulnerable. And in order to tell this story, it's not about sharing our small story here and there, but it's the data. And because of my background, I spent a year at Johns Hopkins studying refugee, not only here, but also overseas. So we have colleagues, it's not just only me and Maggie, we have colleagues across the South Sudanese community that we are trying to come together. I was in a meeting today to develop an ethic model for refugee, because part of it is we don't know. We are not quite convinced that is my information going to be used. And let's not be naive. We have seen how in healthcare there's mistrust of the migrant refugee minority. We are familiar, all of us are familiar with Tuskegee study. And so that has created mistrust among us. So, but what we are telling you, which is Maggie has done a good job, is saying that we are not looking for anything that will identify you. The only thing we need is your information to help yourself and help your community.
Yep, indeed. That's all it is. Thank you, Dr. Thorn. Jacob, thank you so much for adding the information and personal experience. We all in the same boat. With this moving forward, we can see the benefits is to give the information to the feds and to the local authorities to know who is being affected. That's the first thing. The other thing is to identify ourselves, to let the CDC and these other people involved, let them know that we are here and we are part of this big picture. These are the things that we have heard from you. And you also added that being part of that, of this big picture, you have worked with refugees in different settings, not in this area, but different other parts of your career. And you are convinced that these people need to be helped and need to be involved with all the work that it need to be done in the community so they can help themselves. That's my takeaway of the night. To come back to this thing, what other things that are beneficial to this study for the refugees?
Thank you for asking this question, Mabir. So in addition to like we will like publish the so we hope to publish this information, and we will also present to CDC about what our finding. So besides like the funding support to our community, so I think it is also really important for our community to know the situation. Like for example, how many percentage of the refugees were infected during COVID, and how many percentage of the refugees like are concerned about the vaccine, and how many of us were tested by COVID, and we're currently doing social we're currently like doing all different kind of like social distancing strategies to prevent themselves and others. I think it's really important for them to know. But the thing is, I have been struggled to find a good way for people to know this information. But today, this is the first time I'm using this like live show to talk with the community. So I really hope after this data collection, and if we are able to collect a sufficient amount of information from our like South Sudanese community or the other communities, and can we go back to present the studies through your platform? And I think like people like who joined your platform are able to hear this information, and they could share this information to others. And I really hope I really hope we could present the results through your platform. And I really appreciate you doing this. So I think the next step I'm going to do is I will contact the community leader to see if any of their community leaders are doing the same. And I think this is such a powerful way to really make a connection between researchers and the community. I feel like probably people may have a bias about the researchers, like we write paper every day, we don't care what's really going on, but we do. But we really need a connection, like someone like you and Jacob, to make us to really know each other.
Thank you so much. You are already talking to the leaders as you are speaking. Here, one of the leaders has already completed the survey. I don't know if you are watching the comments or not, but if you do,
How
the
to
head
say
of the
comment?
community are here and they're already working on this.
Oh, I see.
Who said that I'm convinced now I fill out the form due to this forum. He's the leader of the board for this community.
Excellent.
And
Thank you so much.
you are in the right place, and this information is well digested and is well taken. If people don't know, then it doesn't exist. The best way for the people to learn and to know is to get the information. And when that information is taken rightfully, it can help the community. We
Exactly.
can see this as a way forward, has the involvement in many activities. You are being watched in Australia, in Canada, in South Sudan right now for what you are saying. But this data that is being collected is very specific to the people who are here in the United States. But the information to help people is generally for everyone. So thank you so much for the time. And if you have anything that is left, Thon, you can still go ahead. If you have more information to present, you can still go ahead as well.
Yes.
I
Thank
dropped a
you.
question from from your talking point.
Thank you all. I'm just so excited. Right now, there are 38 people. For those of you who are just joining, please, it would take you literally less than 15 minutes. We have we have the link there, and please do share. Mabur, we are at the timeline. Our timeline to collect 200 is in 3 days, more like on the 20th. So with this great platform, please share. Dr. Maggie and I will check on the back end. It just shows the general statistics. It doesn't tell about your name, and that will tell how many people are there. My humble request is hopefully by tonight we get 200. We can get more if you can just share it. It's anybody with the technology today. It's amazing how the information travels. So we have a tight deadline. It's on the 20th is our deadline. And Dr. Maggie, we thank you for coming because this community, just let you know for the record, we have been supporting the people back home and people in the refugee camp in places that we came, and we are supporting our families. And in another word, this platform is not only just us talking about the awareness and COVID pandemic, but we have raised several hundreds and hundreds of people, hundreds of dollars through this. We could literally do anything here. This is a dream come true. This is the beauty of America. 15, 20 years ago, no refugee, at least in our community, we didn't have this technology. So we're using the technology to our advantage. My fellow South Sudanese, COVID-19 is real. COVID-19, we need to take care of one another. COVID-19, in the since March, I've been speaking to several of you who have contracted the disease, several of you who have difficulty. There's a really challenges. When I remember also we brought the brave men and women who contracted COVID-19 here, Dr. Maggie, to testify the danger of this virus diseases on this platform. And so now it is time we take this real data to to tell the world and to tell CDC that there's communities, not only South Sudanese communities, other refugee communities are here and we want to help. For example, another benefit is grant writing, right? We have 501c3 as a community. There are several grants out there that, because I'll tell you one example of a big outbreak that was on the news. It was in North Dakota, okay? When all the migrant and most refugees contracted COVID. You know why? They don't have an option. You either show up at work or there's no way to pay your rent. And if they are sick and have a fever, guess what they do before showing up to work? Take a Tylenol so that when you get tested, if B, you're not sick. Why do they do that? It's an economic reason. There's underlying factors. Also, there's prejudice. The politician in that state ended up saying it's the immigrant, it's the refugees who are spreading the disease. You see the complexity. There are factors that we are hearing these stories. Wouldn't it be nice to have a resources? There's several grants out there where if you lose your job for 14 days of quarantine, we could just say in the community, this is something that I'm considering as a health professional in this community. Can we check on that person and say, we can pay your bill? We can pay your phone bill until you recovered. We don't have these resources. So people don't have resources. They are sick. They cannot go to work. So these are the data we want to collect to improve the pandemic. Also, there are people who are raising their kids by themselves. What happened when you contracted COVID-19? You have to drive yourself to the hospital, and it's only you, and you have an infant. What do? Do you leave the children at home? There's no family support. And so these are the challenges. I have heard you as South Sudanese community. I have listened to your stories. Please help us to really formalize this so that we can tell the relevant authorities, whether it's a county health department, whether it's a CDC, whether it's a DH, it doesn't matter. It is time for us to come together and use the data. So that's one thing I want to encourage Mabur. We will know by today, if we don't have 200, we are coming back before Friday, and please share. And we want 200 tonight.
Thank you. Thank you.
Dr. Maybe you may add. Yeah.
Thank you, Jacob. Yeah, thank you. Thank you, Mubir. Thank you so much for the opportunity.
My pleasure. Okay, if we are done, we can wrap it up and end it there. Thank you so much for coming, and thank you so much for giving us the awareness and educating us on this thing. Our community is huge. There are a lot of South Sudanese in the United States, but we don't have a lot of involvement. This is one of those that we want to let our people know that we want to involve and try to introduce. Even look at Somali. Their language is part of the language being spoken in the United States, but there's nothing in the South Sudanese. So why? It's because people do not rise to the expectation and try to deliver what they are expecting from themselves. And nobody is going to do this. So thank you so much. This is for us to convince ourselves and try to do this is the good of the community to be known. Where are we coming from and what have we done? What are the impact of this disease on our people? If the government knows, they will know this population is being affected. It's a small portion for sure to say 200 people. It's not much compared to the population of the United States, compared to the population of the rest of the refugees who are here. Thank you for bringing this into our view. We will work with you on it, and we will get back. I believe a lot of people are convinced and already start filling out the survey, and that data will come to you whether we met the expectation or not. We will try to do our best. We are in the process. 3 days left. It can be done, but it might not. How many days have we had this? Maybe a week or so.
Our goal is to complete the data collection on December 20th. If we cannot complete this, we're probably going to prolong this for another days. But we really hope we could finish the data collection as soon as possible, because we really want this information to send out to others to know the situation.
Exactly. By December 20th.
Yes.
Next Monday.
Yes.
Okay.
We can do it. Thank you, Adil.
Thank you so much.
Thank you so much.
My pleasure.
Thank you. Thank you so much.
Thank you so much.
Take care. Bye-bye.
Bye-bye.
It's non we koi ke ping koi ke monjang ku koi ke urban South Sudanese community in the United States. This is very important. Please speak. It doesn't need your inside information that you don't want to get out. It just needs basic information. And this will register South Sudanese community in the US database that this community has come forward. And you know, we were affected as well. Even if you are not sick yourself, your friend or family member across the country has have had it. So please try to fill out this form. This survey is easy. Go through it, fill it out, and submit it. They will see it at the back end, and your information is not going to go. It shows that the expectation is being met. That's what it is. But there's nothing personal about it that is going to touch individual. That's the expectation, and this is what we're trying to bring to you. Thank you so much. Now we koi ko yen ke yen kan tieng ka tong da aliu na ngadi ku tong da Somali ka tau ku tong da wo koi ke tau tene aliu. Why? Something is not right because na ken ku lu involve ka chin ki nyol throat. Unless book lu involve ku buku ka kwa buku ka nyol no wo kene yen ka bo coin ku kane ke dawodia pa chin ke dit ba be lwel an chi be jamaret message yen ka lewek yongo korku ku yongo chithie to non wo buku ya ko ke community kan kene ale buka jangi ke na non ko ku thie mia ke lwel kan a chu ku thie ne ni na wan kene yen ke kor ku buku ngade yen ka kor bi wo luitin ku buku were buku tol. Thank you so much. And Chibuga Twengaret announcement in Kabaloy will be loaded weekend with tons of information. This coming Friday, a kut de madung malwal, can a team de among a lot of our community members, thin, including Koito, Nea Kutijitan, a kud central team, I members. A kud kana a young lay orphan scholarship. Cake abnang fundraising au ka abnang session bika information de ka kwanki chok a bika belwel ne ye kol e miautu abe apa in tier ku bet anaye Friday ka jang piod abeben ku ka be beket message de diarke abe belen kan work and possible penen kok abeto kunaye the following weekend kaka chaka ting anong post chi nyana pa credit mana yen chol manyok che loy pos wen ten ku ka chating ran dit ran wenda abeben no penin tiro ku the tem tiro ku doro ran chol kwal ding kwal maliet ranong diet gak possible diet ye pakir ke nom ne kek ku ya kun chok yen ga nom ne kek ataw kan yen ran abeben ai ran chi ngich ku ye pinga ye lula ka chirpyo kun chok a chirpyo kun chong lwal ke ran yen ka beben chani din a ye dop ker one of the most popular song in our community of Twitch pa kene ka bro loy ne ye kol yen a support bukuro janyal yen ka luyu wotin e buku nang kolde wodia ku ke be koch bi ka ya lui ni tok yene ka lui wo ku yene ka ye ko rot gam bu nga bu ka pol ni ye kol bu ka koch bu ka loy na ye miatu krande chirana wan be ben ku ber ki chir kan be loy kene ke jot nyal de bai pa na riel ka kol riel yin kra riel loy na nong long ka kol long yin long ye lel kuin bai bi bai be ping ka ka riel ka jwit anong i dol ku ka anong i gov ku ka anong i ka jwe kok chin ran kor ke ka riel ke buku te maret ka wo ye mit ke twi chin ran dir ni ran di de yene ka ye wor chol mit ke twi wo ya ko dir fa ke yene ka bak loy piang kerot ku na nong yi yene ke da ke yene ku lom ku yene ku kwan chok yene ka bi wo nen kolda na piang ke man jam wo tene ke koy ke ka ping ni ka wen yen lo ro koy ka li ku na la ka tida lwel wer chini la twen chini kolda ko koy ka chi jwe ret fa we ya ka tie pa ka ping ni yep ku mal ka ni dol chin ko kun ko koy ka chani chin la twen tawt fa ka ni nga ba tie ti na we koy ret ka nim na ka chini la twen do ko lui na ka den ku na non ko koy ba ye na ka ting ka ye no ngi kolda ka tem ba ka ya ben we koy ko we dia buku lo na buku kwan chok we ti ke ba ki jong le orphan scholarship yen muk maduka ku team dan yen to kan yen ba ka ben mi ha ba ka beping na cho chen ka gam ka yiping wer bi ka ko ka bi ki lwel shanu moin kawaja a chi ben wa na ka chi men tung de mit ke bet a chi la dom ku te ni sukuli a chan chi ping ka lwel ko ke anong i ko mam ka ko chin ko ken a bare aran chirande na cho man met ku cho to ku wun a liu ka ka bar a shanu chien to ku tibitik ben la tinga ka ka pyramid ku ka ben ga man ta su kulik a che jwe so kana yene ke long dio rin ke chan yo ku ke ko ke ka chi ke a ku te ka chen ga ben nyal ku la ka bu ka dam chen nyal wana a chen ni te ga ret ka che ke no ngadi e tas yene ka la loy go man go la tiam go ka wa ja go jor go ya nomde yene ka che ler ku ka che ko ga wi ka ka ru wor ku ting cha ka chen ku ka chi nim to mit ko mor ka de we chi nim to en en ran la twen ye ko la fa ka ne yene ka ke ro lo mit wan chi la dong ke ke doro be ka do ne be ke ni ka ka chol ka ni nga yen ni jong le orphan scholarship yene ka ye ke yelwel yala bay ti dindu bay ti rendu yin nga kai ku ka bi wo ka mi ka bu ko jor ko ka bi ben nang ban ko kolda kene yen ka wer ye kol yen be ben to twen wonim kene ka beto mi ate wo benang educational update broad be loy bi worot wet ku bu worot ta we a jag jag ka dir ku wen we ya ci gak ka le bin ra la jor na tun pie de ku la nyoy pin ku jawan ku na le ben ka ci ku wan ci be yo jaran to ci tap jaran ja taban re pa ka ga ci ko kor bi ko loy au bra la wen be pande u be wan wa chari be yen wel chin ran kor ke na ye mya ke jorom kran kin ke yu pin chan ci wer ci pin pa ka chir ka ga a kor bu ke tin channel le bi ke te ke ye ko rom ko ci ka ngi ara ki ye ran wer de tung de ke dan ci tang pionde bela lwe ke da dara ya ra ci kan ran kor fa yen e mu cha ka le ye be ko ja ke yen pyo tong yin ko man ro fa ka ka ti ka le ka we please look forward bu yo ye ko yen be ben twen ye ma ajede ye mal jima e mi atu mi akol bi wo jam na ka ti kan kuna ye mi atu ke were ka be tuom abaga ting ku ka be weden abi be lwe la cha be tol le ke ti la ye na ka lwe ku ke bi ke jo be lwe ka ko ke abi jo ben we cha ka le ku we cha ke lor we ko ke ben. Thank you so much for your time. Chan chake zaman duan chake yen twi ni ko ku chake yin duan bay. We ko survey chake fill out kana. Let's do it and share it. When a ko kokto. Temku ago ku nang ke ye wo jam. Community to twi below which 200. We way more than thousands of thousands possible. Ku kana le bu lo wa pay. Na chu lo wa pay wo chi jinu ba chu ko. na nong junubi de chi en yo ko yo ko mon jang jam tong jeng te ken we wo de we ko ka yes let's do it wo bu community bu ko present wo bu country bu ko represent ti chi wo kene ti chi wo yen lo yen ke ti te non wo ku bu South Sudan ke country ku ye ku community tan bi ke nang say bi ke nang biag den ni ye ke gwiri a chi pya ret be ton kwarang be tawutan ku ke hard worker iran research lawyer ret ku ke chap ku kanong so many board chen ka involved kani ne kel ni iran pel no mi lo thank you ton kwarang ku ko ke chi ben ke chi dai ni man te ke chi ping thank you jidden we cha ke lech ku we cha ke lor din ba ne job tiyo ka ba ke job ping e din chamir pyo ret e jidit ku kamira pyo ziada ayen abe a part de kajwi ye wo ka jamtin aba kere ka bathol ku pianka
hapa Jonguchor, Nyande 3 East, Kuyetinde 2 East, Pandi di Pura Nyarpe, Yurama, Monchi Yurama. Kedin kitiang kanom, ikui zarial big pan, arial big, kui zarial big, pai kui arial big, zarial big. Pinyang dia, panyara niar pinyang ngadut, panyara niar pinyamanyong ngadut, panyara niar pinyalwale ding, panyara niar pinyai kukuot, panyara niar pinyajang majut, panyara niar panpiel tekenai, panyara niar itwi zarial bin, pai twi arial bin, arial bin, twi zarial bin, ketwinton sukara, pinda utokwe, pinda miting, pinda antawai, kebelbel, pinton sukara, pinda utokwe, pinda miting, pinda antawai, kebelbel, twi zarial bin, manda arial bin, pai twi arial bin, arial bin, arial bin.
tinkiyet kira yarbe tinyi tam chawai wow
nyara nyara pinya de gereng de kwe kanyara nyara pinya jang duot kanyara nyara pinya de nabia kanyara nyara panien de benai kanyara nyara pinya mading majo kanyara nyara pinya ko lebia kanyara nyara pinya de duot kanyara nyara de panda arial de please arial de Kurembi de yual po banang kuchuman Mameranga de chupu loingo la kanya kuli Kidir yon yung mulay kamera juanga Chunka ko pamen wenga pir Kachin yar men wenga pir Kachin yar abuten na kup Kacham yar Ketui zarial big panda Harial big baitu yarial big Pinket yarial big Pinjong sukar, pinjang meeting, pinjau jukul, pinjang tawai, pinjang kebebe. Pinjong sukar, pinjau jukul, pinjang meeting, pinjang tawai, pinjang kebebe.
أيوة يعني كتوك داكا تيندا أي بيوين ميتك شكرا جدا yin pajong chol. Thank you so much. I hope baben ten call da ku bakal wok ka yewel ka kan ka tawa longi ka wel chirka kaka a chiga lwel ni mit ka twi ku ka mi aru ke bu ka ya peng ni nyinde kaka ai nin cha taw ku ka yewo ngi mana de ka panda ka chang ti yen tan ka pyot a chai ket ku ka ni na nom ku yin ket ku ler ni music ku ja ping ku we pyot mi aru dia shukran jiddan we ko ke chi dai ku ko ke chi ping ko ke bi jo bela ping ke jam wo wen anong survey lo yitan ni United States e create wanya wan ci bene survey kana a ci share na group ka twi ka dia lortin ku lo fill out ku ko 200 yen ke limit a level of more than that ku pia rate na ci ku go lo ko we twi ka mabruk ci ku lo ko ci South Sudan a ci ku represent in this data collection yen lo yitan in this study e bengi yinga ci nang issues yinga ci wal kor yinga ci twany social distancing the yi kaka ka dia ke ka gu ke a kan lieu bata ba feel out le wo to kutan ko ci ko ju ci ko won ta sem ku buku panda buku jare nyal ngiai twinda ke ci gam ye tol ku we ku jinobin ci twi taw ci kani cha ka ping e ka dawo dia please help be kan beloy pe nin tiro yen ka ker kuna le ra chelo ka bi ka dil tem bi ke sure ba de chen ka da kor ku buku level loy buku tol let represent wherever you go represent yen ka mesinda ku yen ka chiapa jo ka chelo tinda la ki velvel an ku velvel ba dil de ti yen ngo tin piel da chira yar be na chogran je jalben ka dong ka wo dong yes la twen da ka pet beta waya yen we twinda we cha mo we cha ke lor ne we ko ke bi jo bela ben wo bo ko ke da ka ko 1 hour I hope can we exhausted after chin ke bi wotin che en to pa lo ke ken lo feel out kuna ye mya de pa nin tiro ku aja de pa nin tier ku bet ka we baka jong le orphan scholarship baka be ping yong lwel ka kana tie ke chan we chol ko chin ku de we chol ko chin ba we chol ko ka kwani chok baka be ping non ke yong kwan ke chok e ko mit ke junub ka ko ni ke chan jong le junub ku jong le non counties ke baka jobel ten counties a gudi twi yena ka tawtin ko ke buku ke be jat ko nyal no moral kun man bi wo man ke ku te non ko tin buku gama ya kene yene ke mesen de ko yen be bentu en yo ma arba amin yo ma jede friday kene yene ke te bi wo ko ku na ye next week ka kwal dit kwal den kwal maliata be ben a chirpyo kan chang lwal a beker ku ka baweran ye din ker ti chine dak abaka beping ka pie ko ka jwa rot ku panen ke tui ka die abu ku jong or ka bi ku ke lon tie ke wan chu lo ya chin report lo wan ka je ko ja chila de shukran jiden we cha ka mot ku we cha ke lech we ko ke ben an mo bi dana ngo from the United States. Have a good night. Bye.